us into the 70s by Sunday.
Well, it's time now for a Medical Matters chat with Dr. Michael Manning.
Dr. Manning is with the Mississippi Vein Institute. Thank you for joining us. Why don't you tell us what you do at the Mississippi Vein Institute?
Well, we treat on spider veins, varicose veins, and venous ulcerations.
Now, many women have problems as they age, but some people get them even when they're young, and you can fix that problem.
Sure. I mean, you know, we have patients age 20 up to 95, and I mean, you can get them at any point in life. For the most part, varicose veins are inherited. You know, there's a strong genetic component to that, and so if your parents had them, it's a good chance that you will too. The good news is that we're able to fix them now in such a way that they rarely recur.
And fix them nicely. We've got some before and after pictures. If we can throw up a before and an after picture. There's a before picture
Wow.
and an after picture, and the results are wow. And we're looking here at both varicose veins as well as spider veins.
That's right.
What's the difference between the two? And one's covered with insurance and one isn't.
That's correct. Spider veins are not covered by insurance as a general rule. They're considered a cosmetic concern. That's a picture of a spider vein there, and we clear those with injections, sclerotherapy injections. Varicose veins are the larger veins, the big tortuous veins that you see at the skin surface. We treat those with a combination of laser therapy from inside the vein, and then the varicose veins themselves that are at the skin surface are removed through little micro incisions.
Can men have this problem as well?
Sure, it's about 60-40, 60% women, 40% men. Women tend to get it a little more frequently than men do because of pregnancy.
What is so different today than was different, you know, maybe 20 years ago? Because they had
Sure.
spider vein therapy anyway.
Sure.
I'm not sure what the varicose was, but they had spider vein years ago, but it never quite worked. What
Right.
has changed about it that makes it a different procedure?
In the old days, they used concentrated saline injections, and now we use a foam-based sclerotherapy. The medicine looks kind of like shaving cream when you inject it, and it just works very well at destroying the spider vein at the skin surface. Varicose veins are different. What you got to understand about varicose vein disease is that everything that you see at the skin surface, none of that is your problem. That's a manifestation of your problem. Your problem lives in some leg veins that you can't see. We have to do an ultrasound exam to see those. And so it's critical that you treat that from the inside out, because if you don't and you simply remove the varicose veins, they'll come back.
Now, can they be painful? I've heard people say that they are painful and that sometimes they have a flare-up after they've worn heels for extensive
Sure.
periods of time. Can that happen?
Most of the people come to Mississippi Vein because they are having pain. They're having leg pain, they're having leg swelling, and certainly wearing high heels can aggravate venous symptoms. And the reason is because when you wear high heels, you're not dorsiflexing your ankle when you walk. And you need to do that to clear your leg veins. So when you're wearing high heels, you're sort of plodding like a horse would. And you're just not clearing your leg veins, and so it gets congested and can worsen underlying venous problems.
Well, the varicose veins, you say that the actual problem's not the surface, but something underneath.
Right.
Is that indicative of some type of cardiovascular or type?
No, you know, usually you have arteries that carry blood from the heart to the feet and veins that bring it back. We're talking about on the coming back side. You know, when you have the underlying vein problem, you're not returning blood to your heart like you should. You're pooling the blood in your leg in a particular leg vein that has gone bad on you. And that's where the laser fiber goes. It destroys that vein, and we leave that vein in your leg. That does not have to come out. The only thing that is removed are the varicose veins, which are in fact branches off of the vein that we lasered.
Now, I've also known women who they think it's pockets of fat or cellulite, but it's actually a problem with, can you treat that as well?
Yeah, well, a lot of people come in and they do have bulges on their legs and they'll think it's fat, when in fact it is a vein. And you can tell that sort of thing from an ultrasound exam. The most critical thing is to get an ultrasound exam first. All of that is done at Mississippi Vein. We diagnose the problem, we treat the problem, everything is done at Mississippi Vein.
All right, how invasive or non-invasive are these procedures? And obviously they're two different procedures. One's going to be different from the other.
Right. You know, spider veins on a scale of 1 to 10 are 1 invasive. I mean, they're small injections that are done. We rarely sedate people for that. We do if they request it, but as a general rule, we don't. The bigger cases, we do sedate all of our patients for those. And, you know, you do put in the laser fiber. That's done, you know, through an IV. And then we'd make small little micro incisions to remove the varicose veins themselves. There's no stitching involved. You know, we just put steri strips on. We do one leg at a time. make people wait a week or two in between, but we treat the leg that we're treating all the way, meaning that we run the laser, we take all the varicose vein out, and we clear any associated spider veins all at one time.
All right. Dr. Michael Manning with Mississippi Vein Institute, thank you so much. Certainly a new type of practice, or relatively new and a much needed service for a lot of women. I don't care, I don't know about men, but it's important to women.
Happy Thanksgiving. Thank you so much.
Thank you.
Well, time now to check out today's Quick Flip with